it's not super, of course, common for people to maybe, or I should rephrase this. Yeah, some people are probably overdoing protein and getting too much, but for most people, as we were having a conversation ahead of time, most people aren't going to typically overdo it to get to like the scarier kind of
Yeah,
like protein toxicity levels.
right.
But do you want to talk through like what some of the overdoing concerns are?
Yeah, the biggest one obviously is just like with your kidney function, and so it
100%. Yep.
can if you're overdoing it. And again, this is so individualized. So if there is a predisposed issue with your kidneys, whether it be lupus, and we kind of talked about some of these conditions, but if there's issues with even blood pressure, but we do want to make sure just getting a sense of how much we are getting in, because then that can also, and I guess I'll interrupt myself here, but when we do say either increase or we become more aware of our protein intake, I highly advise to make sure you're getting enough water intake with this.
Absolutely.
Same deal with
Yes.
fiber too, but that's a topic for another day. But we do want to make sure that we're getting enough water so that we, again, like we can filter this a little bit easier through our kidneys and we don't have that dehydration. So
Yeah.
overall, yeah, we want to just, yeah,
Yeah.
be advised on that.
What more people are going to see, though, that the kidneys, I think, are the boogeyman that gets picked on a lot
Yeah.
about, like, don't overdo protein because you'll trash your kidneys. Okay. For most people, let's say, like, most people that are under the age of, like, 60 or 70,
Hmm.
sure, you want to be concerned about it, but realistically, that's kind of like an overblown concern.
Yeah.
Unless, like you said, lupus, polycystic kidney disease, diabetes
Hmm.
type 1 or 2, hypertensive, right? Then, yeah,
Right.
let's have a serious conversation about making sure that we are not going way, 10s, 20s, 30s grams
Yeah.
more protein a day than you need.
Right.
But for the most part, what more of the symptoms are going to be is like if you overdo it, you're going to have more like bloating, gastral distress,
Hmm.
gas, diarrhea, which are still not pleasant, but not as
Right.
terrifying as I'm destroying my kidneys,
Right.
right?
Absolutely.
Yeah,
Yeah. And
yeah,
that's, yeah, no sense of being like fear mongering in that, but that is like the extreme. But you're right. Exactly. Like if you're having too much, you may have some, yeah, just overall abdominal discomfort
yeah,
and notice more things digestive wise.
right.
Yeah.
Yeah.